Thanks very much, Jennifer. Very happy to be here with everyone. I'm coming to you not from Canada, but slightly south as Jennifer mentioned, the great city of New York, but very happy to be with you folks tonight. So I'm going to talk to you a little bit about the Lancet Countdown, and which Jennifer mentioned is now in its 8th iteration. So we have a big international collaboration, 52 different organizations, UN agencies involved. And what we aim to capture is the we work across 5 different working groups. So we have, these aim to capture the fundamental relationships between climate change and health. And the project was started as a sort of a means of drawing attention to this issue. So way back in, I think it was 2009, there was a commission that the Lancet undertook. And for those of you who don't know, the Lancet is a medical journal. And it's considered to be sort of one of the foremost journals in the world. And it was shown that the issue of the potential impacts and, as we now find, the actual impacts of climate change on our health was seen to be a really important issue and needed some further sort of coverage in the media, especially, and also as a repository for sort of the leading science in this field. So, as I mentioned, the countdown, which I think you can access through the link that's been posted in the chat, now in our 8th iteration, across 5 different working groups. So I'm going to talk to you a little about what each of those working groups cover, and then hopefully get into some of the sort of headline findings from this year's report. And then we'll pass over to the other speakers who will talk more about the specific Canadian context. So I'm going to speak about the global context. I should say that I've been involved with the Lancet Countdown for the last 4 years. I think this is my 4th report now. I work on working group 3, which you will see in a second, is the mitigation and health co-benefits working group. So the first section of the report really focuses on the direct health impacts of the changing climate on our health. So that immediately brings to mind increasing temperatures. So I will just scroll down here to my stat. So we the most sort of salient aspect of the relationship between climate change and health is the increasing heat and how that affects vulnerable populations. So if you bring up the report, you can see this in more detail, but the headline finding is that there is a huge increase in the number of people who are exposed to dangerously high temperatures, especially amongst children and newborns, and then also into older vulnerable populations. So that's just one example of that direct health impact. In the second working group, that looks at adaptation and our sort of attempt, I suppose, as a society to cope with some of these changes that are we're going through. In that context, so we're thinking about things like how much funding is going towards adaptive measures, and there's specific focus on the healthcare sector and how much funding healthcare sector receives. In terms of the context there, I mean, the global economy, as many will know, is $100 trillion. And the fraction that we spend on direct health-related mitigation actions is absolutely minute. It's sort of in the hundreds of millions of dollars, which sounds like a lot of money individually, but globally, when we think about the problem, that is really not enough. So then on to the working group 3, which is the working group for which I'm a principal author. That tracks the relationship between mitigation actions and health. So that's anything we do where we try to reduce carbon emissions and the health co-benefits of doing so. So a really clear example is air pollution, and we'll hear a bit more about that in the Canadian context. So if we shift away from incredibly harmful fuels like coal, which have very significant air pollution impacts, that will not only reduce carbon emissions, but also extend lives that are currently cut short through the particulates that are emitted when we burn coal. There are other health co-benefits associated with shifting diets. So if we move away from very high carbon intensive meat production, so red meat, especially beef, is, while it may be delicious, it has a very significant climate impact, and shifting away from excess consumption of that will have one of these, co-benefits where we reduce emissions and also help health. So it's a sort of a good news story, or at least the potential for good news in that working group. Working group 4 looks at the relationship between climate funding and the economic impacts of the relationship between climate change and health. So there, for example, I will just move down to my statistic on this. Bear with me one second. So that's sort of increasing the availability of climate finance to promote a healthy, just transition that will have a significant impact on the relationship between climate change and health. And then finally, just before I pass over to the next speaker, the final working group that we have convened looks at the media engagement with this issue. So this is part of the sort of process of assessing whether we were having impact in the world. And you can see some very significant uptick in the amount of media coverage that this issue gets, which is essential if we're going to do something about it and build consensus to be able to move towards a fossil-free world where we maximize our health. I think that's just about my 5 minutes up. So I will pass over to Claudel, as if by magic. Thanks.